Hi everyone, my name is Nadine Stunzi and I'm a cancer physio, and I'm here to talk with you today about exercising with cancer, how and why. And we're just going to switch over to my slides. And then do a share screen. Awesome. So I'm here on behalf of InReach Online Physio Services. We're doing an education series, and this is Exercising with Cancer, How and Why. A little bit about InReach Physio. It's a telehealth physio company started in 2018 before the pandemic, which was great because now telehealth has definitely become more of a norm. And we offer physio in a whole variety of areas of specialization. You can see here everything from chronic pain to osteoarthritis to neuro rehab, pediatric, cardio rest, pelvic health, lots of different stuff. We've got physios working in all different areas, really exciting. Great thing about telehealth is often you can access same day, if not same week appointments. They do offer direct billing to extended health providers. No doctor's referrals are needed, and we do work with a lot of communities that are remote and rural and up north in BC. We also offer free 15-minute sessions if you're unsure if this is the right service for you. A little bit about myself. My name is Nadine Stunzi. I went to UBC for my bachelor's as well as my master's in physical therapy. I'm a Pink and Steel certified physiotherapist. Pink and Steel is an association out of New Zealand that is really the leading kind of oncology certification for physiotherapists. So I have undergone their coursework. I'm very passionate about exercise as medicine, pain science as well, I think is a really cool evolving area of science, and themes on building resiliency, which is just how we as individuals can learn to kind of take care of ourselves and feel a sense of control and feel like we're growing and learning and moving in the right direction. So I love kind of tools and themes around that stuff. Hobbies since COVID is definitely mastering sourdough. I'm working on strength, barbells and kettlebells, some cycling, and some ocean dips. I'm a cancer rehab physio here in clinic in Victoria, BC, at a clinic called Tall Tree, as well as doing some telehealth through InReach. I work either through the computer or in person. Tall Tree Health in Victoria is a beautiful clinic in Cordova Bay, lots of windows, and just a beautiful forest, lovely setting. I feel very lucky to work there. I have a website, thecancerphysio.com. This is just a resource hub. A lot of stuff that I talk about today, guidelines and decision-making tools, it's all there. Videos and PDFs to download, etc. So go into the website if you like, play around, learn. I'm also on Instagram as well as Twitter. And then my website's also a booking site where you can book either in clinic in Victoria or telehealth. On the agenda for today, part 1, we're going to meet some characters. Part 2, we have some key concepts in exercise as medicine that we're going to explore. Part 3 is where should someone start and what's the role of a PT. And after the presentation, we'll open up for some questions. Our goal today is to understand why exercise is medicine and how to get started with cancer rehab. So let's meet Harry Hadfield. His diagnosis, he's a moon visitor. His goals are to prevent muscle loss, prevent bone loss, manage space fog, which is some changes that can happen with cognitive abilities in the brain when you're up in space, and manage fatigue. So we can see here that even an astronaut is going to undergo some extreme challenges. Sassy Samantha Salsa, another character, stage 2 breast cancer. She wants to prevent stiffness with treatment. There might be stiffness after surgery or after radiation. She wants to manage pain, manage fatigue, prevent muscle and bone loss, and also manage chemo brain. Similar to space fog, it can have cognitive effects on the brain after undergoing chemotherapy. Meet Tom the Toolman. His diagnosis is stage 3 colon cancer. His goals are to maintain weight, manage pain, manage fatigue, prevent muscle and bone loss, and manage chemo brain. Same thing with Tom. It can be seen in cognitive changes, similar to space fog, that often patients notice they're just not as sharp. So what do astronauts and people with cancer have in common? Well, they both undergo direct hits. Chemotherapy can be like a direct hit. It's a shock to the body that can have some impacts. And reduced gravity is also a direct hit. The physiological impacts are loss of bone mass, loss of muscle mass, aerobic decline, difficulty moving due to space or fatigue, and cognitive changes like we talked about, kind of like baby brain or chemo brain or space fog. There's some trouble finding words and some changes in the kind of sharpness of your brain. And there's some tricks that you can do to help manage that. The good news is that whether you're an astronaut or whether you're someone with cancer, you all benefit from exercise. The interesting fact to point out is that when someone goes up into space, for months before, they undergo a lot of conditioning and a lot of exercise programming. They have a strict exercise plan up in space, and then they undergo a lot of exercise programming and rehab after coming back. So I'd like to ask, why is it that people with cancer don't undergo such protocols? Just something to think about. Let's talk about our first key concept, the immune system. Looking at this chart, this is even a simplified version. We know that the immune system is complicated. We know that it attacks foreign antigens, and it's generally a defense mechanism. You can see some circular immune cells here. You can see some squares that are chemical mediators. I'll talk a little bit about chemical mediators in my presentation. But we know generally, despite the fact that it's complicated, and there's some anti-inflammatory and inflammatory chemicals that can kind of have cascading events, we know that generally there is a profound immune response with an acute bout of exercise. So what about aerobic activity, like getting your heart rate up? I want you to take a look at the graph on the left and notice just the red line, because the red line is when your body temperature warms up. And these are people that are cycling. So their body temperature warms, as we know, when you undergo aerobic activity. And notice with all of these graphs, all 5 of them, that there's an increase in that red line for a certain amount of time, and then it goes down. The point is just that exercise intensity and duration matter because there's an immune response at that time. So anywhere between 45 to 60 minutes, we see some hormones levels raise that can affect immunity, and we see a rise in some immune cells in the first bit of exercise. Let's have a look on the right at the other graph. Lines all over the place. Focus in on the navy one. What do you see there? In between 0 and 2. That navy one spikes up, and then all of a sudden it goes down. The point is that this navy line represents natural killer cells. Natural killer cells attack things that might be loaded with virus, but natural killer cells are also known to be tumor attacking or necrosing, fighting cancerous cells. So we see here that there's a rise of these factors in these cells even within a short bit of exercise, around 45 minutes. And yes, it does go down after, but over time that pattern may change. The point here is that we have things in our body and with our immune system that change when we exercise. That's the bigger picture that's really exciting to focus in on. What about strength? Well, we know that strength, muscles, they're juicy. They actually secrete something, and it's called IL-6. And so that actually has a cascading effect on immunity. So when you actually use your muscles and you do some strength training, you're actually secreting more of this chemical mediator, and it affects immunity. We know that generally, you can see on the chart on the right, it's a bit complicated, lots of things happen, but the overall picture is one of anti-inflammation. So it is seen that sedentary individuals are just found to have more found to have more systemic inflammation. This is likely at times, they think, due to kind of this IL-6 chemical mediator through strength training and muscle use that has an overall anti-inflammatory effect. So just to kind of ask some questions here, we've talked a little bit about those natural killer cells in the last diagram that kind of spike up with aerobic activity. And in this chart here, we see tumor necrosing factor. So even 30 years ago, they identified some of these factors and some of these cells that are part of immunity that increase with exercise and that do have an effect on cancer cells. We don't know too much, and we're still researching a lot, but keep your eyes open for this TNF, for this NKC. This exciting stuff lies there. But also we just kind of want to ask, in this strength context, is yoga enough to secrete this IL-6? Is lifting a barbell to fatigue too much? So these are kind of valid questions that we're asking that I'm sure we'll find out more about over time. So we know exercise is medicine, and the research is just exploding. In the last decade, there's been a 200% increase. We know that rehab matters in its timing, If you can get to people with cancer, especially breast cancer, early and teach them rehab and exercise, they get better physical functioning. They can assure that their shoulder can get into the position it needs for radiation. So timing matters. We also know that generally exercise has shown that patients will report better quality of life, better physical functioning. Even a healthy population can testify to this. Move more, feel better. Exercise a bit, maybe even mentally feel better. So it's the same with people undergoing cancer treatment. Even if they are in the hospital undergoing a stem cell transplant, generally they reported that exercise helped them to feel better, even if they were very fatigued. So that's a key message to take home here, because a lot of cancer patients really struggle with fatigue. We know that exercise is medicine in some other contexts too, and this is early science with mouse models, but it's really exciting to see tumor reduction. Sometimes in some of these studies, the tumor went down from 31 to 67%. We also saw that some of the chemotherapy drugs were more effective with exercise in mouse models. So exercise may actually increase drug efficacy and may actually decrease tumor size. So that's pretty exciting science, although it's early. It's neat to hear. So what does all this mean? Where do we start? We've met some characters, we've explored some key concepts. Now we know generally guidelines have been released specific to the cancer community. If there's anything I want you to take from this presentation, it's this: all people with cancer should avoid inactivity. Now, more specifically, there's guidelines that they can try to stick to for most kind of exercise as medicine. But even just trying to avoid inactivity is really beneficial and important. But the guidelines do state for exercise as medicine that 30 minutes of moderate to vigorous aerobic exercise 3 times per week is recommended. If deconditioned, you need to build up really slowly. Now, this RPE, which is the rating of perceived exertion, which is how hard you feel like you're working, should be anywhere between a 5 to an 8 out of 10. If you go back there, you see moderate to vigorous. Now, those are big words that might be really scary, intimidating. So it takes time to get there safely. But if you can get there to a point where you feel like you're exercising pretty hard, a lot of really great exercise medicine effects can take place. We also know that patients should be undergoing 2 resistance training sessions per week. This is because, well, strength affects immunity, but strength also affects joint health, function, posture, pain, all sorts of stuff that we also know about now too. But generally, when it comes to bone density, it takes a long time to have an impact, almost 12 months. And there has to be some high impact training in there. But that shows that for things like bone cancer, strength training is really important. We also know, and this is really exciting, that supervised progressive strength training does not exacerbate lymphedema. For a while in the lymphedema community, we kind of thought that patients who had a lot of swelling and lymphedema concerns shouldn't really move, and if there was a bit of swelling, that was a concern. We know now that swelling can kind of come and go, as it does normally even in a healthy person with exercise, but all in all, that bigger picture is that strength only has a positive impact. So patients with lymphedema should be undergoing strength training. So here's some more key concepts and kind of where we should start. This is a diagram that just kind of helps patients understand how to get started. Is medical clearance needed? Do I need to see my doctor? Can I just see a physio? Can I see an exercise physiologist? Kind of helps you navigate some of those questions, because there is certain types of cancer and certain scenarios where you do want medical clearance. This is for free on my website. Feel free to download the PDF at thecancerphysio.com, or just take a screenshot of this if you like, but this kind of helps break down how to start safely. This is an example of a few things to consider. If people with cancer are running a fever greater than 38 degrees, or have certain changes to some of their hemoglobin, neutrophil, or platelet counts, their complete blood counts are something that you should keep an eye on to know that your immune response is where you want it to be and it's safe to exercise. There is also some heart rate guidance and blood pressure parameters that you want to be thinking about. In addition, really extreme fatigue and increased nausea that's not manageable are also variables to pay attention to. So there's a few kind of things we want to keep in the back of our mind when we're prescribing exercise as medicine. So what's the role of a physio? Well, in all honesty, if you've gone through that decision-making tool on the last page and you're not running a fever and you don't have any heart rate or blood pressure issues and you're feeling good, then just get started. That's what's really amazing, is exercise as medicine is available to everyone. If you are having some physical setbacks and you do have some symptoms such as pain or joint dysfunction, lymphedema, a lot of fatigue, There can be post-treatment complications such as frozen shoulder, cording fibrosis. Neuropathies are a big one that I see a lot in the clinic. Then maybe you need a little bit of clinical expertise to help you get started. The other thing that we know is that physios can just help provide safe exercise and an individualized program. As you know, with exercise, it's hard, even for a healthy and motivated person. It's hard to sometimes find the motivation or understand how to do it correctly. It's hard to sometimes make sure we don't get injured. So that bit of supervision and clinical expertise can go a long way in sticking to it. The other thing we know is, well, supervised exercise works, and this is for everyone. Why do people love Peloton and group exercise and CrossFit gyms? Because working together and having a coach and having support is amazing for motivation. So sometimes having that extra little bit of help just goes a really long way. So some of the key messages I really want you to take home from this, if anything, is that exercise does produce an immune response. So that's really exciting. Exercise helps physical function and well-being. The timing of rehab matters. Sometimes if you can get access to a rehab plan or exercise as medicine even before treatment, you can optimize the whole journey and make sure that you're in your best shape for all of it. We know the cancer journey changes too, so have a plan, connect with someone early. Clinical guidance may benefit. Sometimes you'll need the support and advice of a physiotherapist or your doctor. Sometimes, as according to that decision-making tool, you don't. So it really depends. Get clearance if needed, and if not, start today. And the last point is my favorite, and I really just want to emphasize that astronauts and people fighting cancer are both heroes. So today's goal was just to understand why exercise is medicine and how to get started. I hope that we were able to meet your goal today. I just want to give much thanks to the cancer community locally, nationally, and globally for providing support, services, and pushing the frontiers of research. This is just an article where I was published in our provincial association magazine quite a few months ago, just on exercise as medicine and the role of physiotherapist. And in the bottom is some references. And they are the references that I used for much of this presentation. Further reference links can be available on my website at www.thecancerphysio.com, as well as the decision-making tools, videos, and all sorts of resources from a lot of what we talked about today. Thank you so much for your time and for tuning in, and feel free to email at connect@thecancerphysio.com if you have any questions.